shows is that we are, not only we, but I think the whole medical profession, we are very much more interested now in patient engagement and support. And that doesn't always happen, but I think that these are topics that are very hot, so to speak, in all fields of medicine and surgery, and they are very important. Engagement with patients help to make decisions, different models of care, and that leads us directly into the next talk, which is going to be given by my friend and colleague in the Department of Surgery, Erin Kennedy, who is an associate professor of surgery in the University of Toronto, and also in HPME, which is Health Policy Management and Evaluation. She's also an associate professor there as well. And she is going to talk to us about what I think is our new models of care, different models of care, try to get us closer together with patients, find out what they are really thinking and how we can support them better. And these new models of care are rampant throughout the entire medical community right now. So very timely in all fields, and particularly, I think, in the field of polyposis, where there are so many questions and so much stress for parents and their families. So, Erin?
Well, welcome everybody, and I'd like to thank Zane and Kara for having me today. I'm really happy to be here, and I love talking about this topic, so you might have to cut me off at 15 minutes. Anyways, I'm going to change gears just a little bit, and I'm not going to talk specifically about FAP or polyposis, but I am going to talk about the U of T Department of Surgery Patient Experience Project. And I think that it's pretty applicable to patients with polyposis, because many of these patients will need to have surgery over their lifetime. And our project really was to try to improve the surgical experience of our patients at the University of Toronto. The objectives of my talk really are to give you a brief overview of the University of Toronto Department of Surgery, and hopefully give you a little bit of an idea of how Mount Sinai fits into the infrastructure of the university as an academic teaching hospital. To talk a little bit about patient engagement, what it is and why it's important. Then to talk to you a little bit about the U of T the U of T Department of Surgery Patient Experience Project. And then talk to you about what we've done at Mount Sinai as a result of that U of T project in a quality initiative that we've done called Home to Stay. So the University of Toronto, the Department of Surgery, is one of the largest departments of surgery in Canada. It has 8 academic teaching hospitals and 8 different surgical specialties involved. And at the University of Toronto, there's over 275 full-time surgeons. And the overall goal of the department is really to improve the health of Ontarians and Canadians by really leading innovation and surgical practice, as well as education and research. I don't know if you can read this, but the Dean of Medicine described the Department of Surgery at U of T as a top destination for outstanding faculty and trainees, transforming healthcare through the application of discovery and knowledge. And you can see just under the values section at the top value at the Department of Surgery is excellence in patient care. And the chair of the Department of Surgery is Jim Rutka, who's a neurosurgeon at the Hospital for Sick Kids. And when he became the chair in 2012, he actually commissioned a whole bunch of different committees. But one of the committees was the Quality and Best Practices Committee, which was headed by Robin McLeod, who was a surgeon here, but was really the objective of this committee was really to improve the quality of surgical care and education across the University of Toronto and all the hospitals involved in the University of Toronto. And it's really because of the vision of Jim and Robin that we did this patient experience project at the Department of Surgery. And so I think in a nutshell, what I'd like to say in terms of the Department of Surgery is just like these two little boys in this picture and most of us. That surgery, that quality really does matter to the Department of Surgery, and we really want to make the surgical experience, a sort of positive one for people. In terms of patient engagement, there's been a lot more focus on patient engagement. And what it's what it's defined as is meaningful and active involvement of patients, caregivers, clinicians, and other healthcare stakeholders throughout the research process or quality improvement process. And it represents a real shift of the role of the patient from sort of a passive bystander or data point to actually an active individual in research or in a quality initiative project. And it's similar to what we've been finding in clinical practice over probably the last 10 to 20 years, that we're shifting from a more passive, paternalistic approach to decision-making and discussion with patients to a more active and shared decision-making process. And the reason for this is that there has been a lot of research to show that when we involve patients and we involve stakeholders, the product is a lot better, that we have higher rates of enrollment and retention in studies and initiatives. The results are more applicable to both patients and physicians, they're more important, and because of that we have better compliance to treatment, and this leads to way better health outcomes. So overall, there's been a real focus on involving patients and having patients involved in a lot more research and quality initiatives. And so what we did for our patient engagement project at U of T was we planned a series of 3 meetings with patients and physicians. And really what the idea of this was to map out the ideal surgical experience for patients. And also then, while we were doing that, to identify gaps in cares or opportunities for us to improve on the patient experience, and then work together at the last meeting to develop strategies together to improve the patient experience. And for these meetings, we had 30 patients that represented all of the 8 divisions and the 8 hospitals, and I'm happy to say we did have 1 pelvic pouch patient as a representative. And we also had 16 surgeon representatives as well who participated in the meetings with the patients. And again, we had representation from all of the 8 divisions and 8 hospitals. We really used a starting point. We had a very basic framework, and we asked patients for each one of these buckets to give us sort of their best experience and their worst experience, and we used those experiences to build the ideal surgical experience for our patients. And what happened was, while we were building this framework and we were finding out all of the best experiences, we also came up with about 60 priorities or 60 areas that we felt could be improved in terms of the surgical experience. And together we worked as a group to pick what we thought out of those 60 were the top 10. And these are the top 10 that came out of that meeting. And I think what's really interesting is that they all involve communication and information giving for patients. You can see the first 3 were all about discharge planning and recovery at home. We know that all of our patients want to have access to electronic medical record, and we're looking at that at Mount Sinai now, and physician communication. So there were a lot of items out of the 10 that all sort of revolved around transitions in care and communication. From this list, our group decided what are the most actionable items that we can do across the whole University of Toronto that would be applicable to all 8 teaching hospitals and all 8 surgical divisions. And what our group came up were these 3 items. We wanted to look at ways that we could work on physician communication. We wanted to improve and standardize our discharge process across hospitals. And we wanted to also improve recovery at home and help patients understand what to expect after they go home after surgery. This is just sort of what our meeting room looked like with the patients. This was our last meeting where we were sort of discussing strategies to improve the patient experience and the 3 items that I just discussed. And I think what came out of that, of those 3 items that I showed you, is that really expectations at home or recovery at home was probably the most important thing to this patient group. And I think it makes a lot of sense when I have to say it was not on my radar until I was at these meetings, that when patients go home, you know, when you're in surgery, you're seen by the surgical team every day, and then all of a sudden you go home and there's nobody to see you anymore, and you're not feeling all that great, and you don't know what normal is anymore. You don't know if all the things you're experiencing are normal or not normal, or it's bad or it's good, and it creates a lot of anxiety and stress for patients once they're discharged from hospital. And so this was a really important aspect, and at Mount Sinai what we decided to do is have an initiative where we would develop an integrated monitoring system after patients went home, and we would use a mobile app as the platform for this. And this is just sort of a quick look at it, but the idea was patients would enter their data into an app. It would come through a secure website to us at the hospital. It would be reviewed by the surgical team, and if there were any concerns, the surgical team would contact the patient. And I'll just give you a couple of ideas of what it looks like. So it would send a reminder to you every day via email to say, can you please fill out your health check for the day? It would give you a list of things you could start doing while you were at home. And it would also provide education, or credible and education for questions that you had, and we would also relate it back to your health check answers. So here you can see a patient might have had some skin irritation around their stoma, and here you can see it says the names of the stoma nurses are Monica and Julie, and you should give them a call. And if you want to learn a little bit more about what to do, there's an education module for them. And again, as I said, here is just an example of some of the questions we asked: how much pain you were in. And you know, here we had red flags, so if somebody scored a 10 out of 10 or a 9 out of 10 on a certain day, we would have a red flag, and that would be notify our healthcare team to do a call back to that patient to make sure that they were okay. The app also had photo capabilities, so that if you had a problem with your wound or your stoma, you could take a picture of it and send it to us, and we could look at it and give advice that way through a phone call. And again, this is just a dashboard of what things look like, and you can see, I don't know if you can see, but this little orange said this person had a score that means that we need to look at this data and call them back. So we had red flags available to our healthcare team to flag callbacks to patients. Let's see. So for our Mount Sinai, we after we developed the app, we wanted to sort of test it out and see what the patients thought about it. So we had 106 patients at Mount Sinai who were undergoing elective colorectal surgery from November 1st, 2016 to February 28th, 2017. That we invited to download the mobile app in hospital on post-operative day 3 as part of this integrated monitoring system, and to help support them after they went home. It was available on iPhone, Android, PC, and you could use it on your computer at home as well. And of the 106 patients, 81 patients used the app at least once, and we have data for them. So as you can see, the patients, this is just sort of a little breakdown of the patients. In general, they were pretty young, 43 years old. And you can see just at Mount Sinai that 63% of the surgeries were for inflammatory bowel disease. And again, probably about 30 to 40% of the surgeries, again, were for inflammatory bowel disease. About 22% were subtotal colectomies, which is usually the first part of the pelvic pouch, and about 10% of the surgeries were pelvic pouch. About half of them were done laparoscopically, and I think what is also a very important number is about 50% of our patients had a new stoma, which is a fairly significant rate, and we know that patients with a new stoma also have significant challenges once they go home. And now with pressures to decrease our length of stay. It means you even have less time to learn things in hospital, and this group of patients needs quite a bit of support. Our length of stay was about 6 days, which is quite good. Here you can just see was the uptake of the app, the first 14 days at home. On average, most patients use the app 6 times, and they usually used it between day 3 and day 9. And after patients used the app, we actually got feedback. We had a focus group with the patients afterwards and asked them what they thought of the app. And really over 90% of the patients were highly satisfied with the app. 100% said they would recommend it to other patients. And the main reason they said that they used the app was that their data was being monitored by the healthcare team, and that sort of increased their confidence about being at home. And it also, because of the way the questions were structured, gave them more confidence about what was normal and what was not normal. And sort of as they started using it, it helped them to sort of increase their confidence managing sort of post-op problems at home. They also liked the 2-week time frame and the ability to sort of use the app when they wanted to or if they didn't feel they needed to, that they didn't have to. And here's some of the comments. Some of the patients said, "It made me feel less alone and good to know more help was there if I needed it. I liked feeling connected to the medical team after leaving the hospital and the ease of reaching out to them. It gave me a chance to give details of any post-surgical problems so that they would be addressed based on priority of the need. It saved wasted time seeing a doctor for post-surgical issues that were minor." One of the, other than the patient satisfaction that was very important to us, one sort of unexpected thing that we are really happy about and interested in is that the readmission rate was 6.2%. And in the months leading up to using the mobile app at Mount Sinai, the readmission rate was about 18%. So we think that the mobile app also is able to decrease readmission rates to hospital. And this is not controlled data, but we are sort of very interested in sort of if this is helpful in terms of decreasing readmissions for patients as well. So in terms of the next steps, we want to continue to use and evaluate the mobile app at Mount Sinai. We're working with the hospital to ensure that we're able to sustain the use of the mobile app over time with our patients. And it's also led to a bigger grant being submitted by our group to evaluate the effectiveness of the mobile app across Canada. So I think that's it. Thank you very much.